Hi, my name is Abraham Moscoso, and I'm going to talk about Rivabirin for chronic hepatitis C virus infection in transplant recipients. So first we will see a video.
Hepatitis E is RNA virus. Spread by the fecal-oral route. Incubation period 3 to 8 weeks. Common in Central and Southeast Asia, North and West Africa, and in Mexico. Causes a similar disease to hepatitis A, but carries a significant mortality, about 20% during pregnancy. In general, hepatitis E is a self-limiting viral infection followed by recovery. Prolonged viremia or fecal shedding are unusual. In acute infection, IgM antibodies to hepatitis E virus are positive. Does not usually cause chronic disease. A vaccine is currently in development, but is not yet in widespread use. Thank you for watching.
So definition: hepatitis E is a liver disease caused by infection of a virus known as hepatitis E virus, HEV. Every year there are an estimated 20 million HEV infections worldwide, leading to an estimated 3.3 million symptomatic cases of hepatitis B. So we will see another video. So applications in medicine. The hepatitis E virus is transmitted mainly through the fecal-oral route due to fecal contamination of drinking water. This route accounts for a very large proportion of clinical cases with the disease. The risk factors for hepatitis E are related to poor sanitation, and hepatitis E virus is created in the feces of infected people to reach drinking water supplies. We'll see a video.
¿Qué es la hepatitis E? En esta ocasión vamos a hablar de la hepatitis C. Los invito a suscribirse al canal en YouTube, a seguirnos en Facebook, en nuestro foro de discusión para pacientes con cirrosis hepática, y si les gusta este video, virus que ataca al hígado y ocasiona una inflamación aguda y por ende un daño importante. Es una infección que se consideraba originaria de África. Sin embargo, a lo largo de los años se ha observado que es frecuente en los países en vías de desarrollo, que incluye Latinoamérica y México. Es una infección que se transmite particularmente de seres humanos a seres humanos, es decir, a través de una ruta fecal oral. Pero también se ha observado que algunos animales, como los cerdos, pueden transmitir esta infección, es decir, una mala higiene de manos puede favorecer la infección o un mal cuidado de los animales de la granja. ¿Y qué síntomas da la hepatitis E? La hepatitis C se comporta como una hepatitis aguda, un cuadro similar al que presentan los pacientes que tienen hepatitis A, es decir, pueden presentar un cambio amarillento de la piel, lo cual se conoce como ictericia. También pueden presentar una orina de color muy oscuro o unas evacuaciones de color muy claro. También se puede acompañar de fiebre, de malestar general y de alteraciones en las pruebas de laboratorio, una de las manifestaciones más frecuentes. ¿Y si tengo un cuadro clínico, cómo se diagnostica la enfermedad? Dado que esta enfermedad puede pasar asintomática o puede confundirse con otros cuadros, el paciente puede mejorar de manera espontánea sin habernos dado cuenta que presenta la infección. Sin embargo, en aquellos casos en los que se sospecha la infección, es decir, en pacientes que no tienen infección por hepatitis A, que es el diagnóstico diferencial más frecuente, se pueden realizar pruebas de laboratorio donde se buscan las proteínas que produce este virus.
Pros and cons. In rare cases of acute hepatitis E can be severe and result in fulminant hepatitis, acute liver failure, and these patients are at risk of death. Fulminant hepatitis occurs more frequently than hepatitis C or occurs during pregnancy. We will see the last video.
Over 85,000 new cases of hepatitis are diagnosed yearly in the United States, according to the Centers for Disease Control. The CDC defines hepatitis as a family of viral diseases that impact the liver. 5 of the 6 types of hepatitis are defined by letter distinctions. According to the Mayo Clinic, hepatitis A is a mild infection that generally causes flu-like symptoms. The impact of hepatitis B can range from a mild illness to a long-term disease, according to the National Institutes of Health. The Mayo Clinic states hepatitis C often causes a lifelong illness that can lead to cirrhosis or liver cancer. According to the World Health Organization, hepatitis D and E are rarely found within the United States, but are common in developing countries. The Mayo Clinic describes alcoholic hepatitis as generally tied to long-term alcohol abuse. The basic treatment for all forms of hepatitis is rest, a diet filled with fresh fruits and vegetables, and avoidance of items that could cause further damage to the liver, according to the Mayo Clinic. Avoiding alcohol, herbal supplements, and all drugs not prescribed by a physician is advised by the Mayo Clinic. Treatments for hepatitis A, B, and E generally take a wait-and-see approach, as there are no specific treatment plans for these infections, according to the World Health Organization. Medical oversight may be needed to help control symptoms, and the Mayo Clinic states antiviral medications may be prescribed based on your condition and length of illness. The Mayo Clinic states hepatitis C is often treated with antiviral medications, but may require a liver transplant if severe damage has occurred. Your doctor may advise you to obtain vaccinations for other forms of hepatitis, pneumonia, and the yearly flu shot, according to the Mayo Clinic. According to the World Health Organization, treatment for hepatitis D consists of high doses of the drug interferon and liver transplantation for end-stage chronic hepatitis D.
Well, in conclusion, ribavirin as a monotherapy may be effective in treating chronic HEV infection. A 3-month course seems to be an appropriate duration for this therapy, though therapy may be given to heavily immunosuppressed patients and those who still have viremia 1 month after the initiation of therapy. Thank you so much.